This year we had the opportunity to present updated results and biomarker analysis from the PROpel Phase III study. So very briefly, the PROpel Phase III study is looking at patients with first-line mCRPC who are allowed to have chemotherapy in the hormone-sensitive setting before coming into the study. And we took patients all-comer, irregardless of biomarker status. So we obviously had the majority of patients without homologous recombinant mutations, but we had also patients that came in with HRR mutations. And as expected, about 70% had no detectable mutation, about 30% with detectable mutation. And we already presented and published the first analysis showing that we had significant improvement in rPFS in the overall group of over 8 months with a risk reduction of 34%. With this updated analysis, now we have longer follow-up, and what we show is that the rPFS is actually improved to 8.6 months, but in terms of biomarkers, patients with or without detectable biomarkers have improvements in rPFS that are both below 1 in terms of confidence intervals. So very convincing data that patients benefit from the combination of Olaparib and Abiraterone compared to a worldwide standard of care of Abiraterone alone. Obviously, patients with mutations seem to have even greater benefit, but even those without mutations had a hazard ratio of 0.76, and by independent review had rPFS improvements of 11 months in patients without BRCA mutations. Those with BRCA mutations had a hazard ratio of 0.23 compared to the standard of care of Abiraterone alone. So very convincing data, and added to that is updated overall survival analysis. When we first presented and published, we only had 28% of deaths. So we were trending in an interesting direction, but still not significant. Now with updated analysis and 40% of deaths, we now have a p-value of 0.11 and a hazard ratio of 0.83. So clearly showing that there is a very strong trend towards an overall survival improvement, even though the study is relatively small of only 800 patients with an active control arm.